This session we will be discussing the legal aspects of nursing informatics, specifically the HITECH ACT and HIPAA. At the end of this session, you will be able to discuss the role of the healthcare informatics professional in relation to legal and ethical issues, explain the differences between privacy, confidentiality, and security and protection of healthcare information, and describe the role of the nurse in legal and policy issues for protecting health information. The Federal Information Technology for Economic and Clinical Health Act of 2009 was enacted in February 17th as part of the American Recovery and Reinvestment Act, or ARRA. The ARRA, also known as the Stimulus Law, was enacted to stimulate various sectors of the U.S. economy during the most severe recession in this country had experienced since the Great Depression of the late 1920s and early 30s. The health information technology industry was one area where lawmakers saw an opportunity to stimulate the economy and improve the delivery of health care at the same time. This explains why the title of the HITECH Act contains the phrase for economic and clinical health. The ARRA is a lengthy piece of legislation that is organized into two major sections, Division A and Division B. Each division contains several titles. Title 13 of Division A of the ARRA is the HITECH Act. It addresses the development, adoption, and implementation of health information technology policies and standards and provides enhanced privacy and security protections for patient information, an area of the law that is of paramount concern in nursing informatics. Title 4 of Division B of the ARRA is considered part of the HITECH Act. It addresses Medicare and Medicaid health information technology and provides significant financial incentives to healthcare professionals and hospitals that adopt and engage in the meaningful use of electronic health record technology. At the time the HITECH Act was enacted, it was estimated that less than 8% of U.S. hospitals used a basic electronic health record system in at least one of their clinical units, and less than 2% of the U.S. hospitals had an electronic health record system in all of their clinical settings. Not surprisingly, the cost of an electronic health system has been a major barrier to widespread adoption of this technology in most healthcare facilities. The HITECH Act seeks to change that situation by providing each person in the United States with an electronic health record. In addition, a nationwide health information technology infrastructure will be developed so that access to the person's electronic health record will be readily available to every healthcare provider who treats the patient, no matter where that patient may be located at the time treatment is rendered. The HITECH Act established the Office of the National Coordinator for Health Information Technology, so the ONC, within the U.S. Department of Health and Human Services. The ONC is headed by the National Coordinator, who is responsible for overseeing the development of a nationwide HIT infrastructure that supports the use and exchange of information to achieve the following goals. 1, improve healthcare quality by enhancing coordination of services between and among the various healthcare providers a patient may have, fostering more appropriate healthcare decisions at the time and place of delivery of services, and preventing medical errors and advancing the delivery of patient-centered care. 2, reduce the cost of healthcare by addressing inefficiencies such as duplication of services within the healthcare delivery system and by reducing the number of medical errors. 3, improve people's health by promoting prevention, early detection, and management of chronic diseases. 4, protect public health by fostering early detection and rapid response to infectious diseases, bioterrorism, and other situations that could have a widespread impact on health status of many individuals. 5, facilitate clinical research. 6, reduce health disparities. And 7, better secure patient health information. Improving healthcare quality has been an ongoing challenge in the United States. According to the Agency for Healthcare Research and Quality health care is the care that is safe, timely, patient-centered, efficient, and equitable. The Agency for Healthcare Research and Quality, an agency within the Health and Human Services, has been releasing a national healthcare quality report every year since 2003. And the current report, not unlike previous reports, finds the quality of healthcare in the country to be suboptimal. The National Healthcare Quality Report also has discussed the need for health information technology to support the goal of improving quality of care. Developing a national health information technology infrastructure is an enormous an extremely complex undertaking that requires extensive financial, technological, and human resources. The HITECH Act established the ONC, as noted earlier, and the Health and Human Services appointed a national coordinator who is responsible for the development of the infrastructure. The HITECH Act also established two committees within the ONC, the Health Information Technology Policy Committee and the Health Information Technology Standards Committee. The Policy Committee is responsible for making recommendations to the coordinator about how to implement the requirements of the HITECH Act, such as the technologies to use in the infrastructure. The Policy Committee has a total of 20 members, one of whom must be a healthcare provider. At least one of the healthcare providers must be a physician. There is no specific requirement that a nurse be on the Policy Committee. The HITECH Act also provides monetary incentives for providers who engage in meaningful use of health information technology. Meaningful use is defined as using electronic health records in a meaningful manner, which includes, but not limited to, electronically capturing health information in a coded format, using that information to track key clinical conditions, communicating that information to help coordinate care, and initiating the reporting of clinical quality measures and public health information. Monetary incentives are available to clinicians and facilities that implement electronic health record systems that meet the specific standards. Providers that fail to adopt such systems within a specific time frame may be subject to significant government penalties. The prevalence of healthcare-associated infections serves as an example of how to use electronic health record technology and nationwide HIT infrastructure can play a significant role in addressing healthcare quality issues. According to the National Healthcare Quality Research Report, wound infections are a common occurrence following surgery. But hospitals can reduce the risk of these healthcare-associated infections by making sure patients receive an appropriate antibiotic within the hour before their procedure. The Centers for Medicare to Medicaid Services already has the capacity to track Medicare patients who receive this prophylactic treatment and the rate of post-surgical wound infections for those patients who do and do not receive the treatment. Imagine being able to track this issue for all surgical patients and developing evidence-based care plans to ensure that all patients within the infrastructure receive the same quality of care. This is just one of many examples in which the end result of EHR adoption is better patient outcomes. EHR technology also will make it easier for all providers involved in the patient's care to readily access the patient's complete and current health care record, thereby allowing providers to make well-informed, efficient, and effective decisions about a patient's care at the time those decisions need to be made. This is of tremendous benefit to patients and promotes a higher level of patient-centered care. It also allows effective coordination of care between and among all providers involved in the patient's care, including doctors, nurses, therapists, nutritionists, hospitals, nursing home, rehabilitation facilities, home health agencies, laboratories, and other diagnostic centers, thereby assuming the continuing of patient care. Such an integrated system would have clear benefits for patients and providers alike. For example, imagine how much easier it would be for a patient with a rare form of cancer to obtain a second oncologist's opinion before beginning a course of treatment. The patient's complete record, including the results of numerous diagnostic tests conducted at multiple sites, such as blood tests, biopsies, radiographs, and scans, would be readily available to the second oncologist. Imagine how much easier it would be for a patient with end-stage renal disease who is receiving outpatient hemodialysis several times a week to receive appropriate treatment if he or she is suddenly hospitalized or would like to take a vacation out of state. Imagine how much easier it would be for nurses to complete a medication reconciliation for a newly admitted patient. These possibilities are endless, and these savings realized from enhancing quality, avoiding duplication of services, and streamlining delivery patient care are obvious. Nurses have been complying with HIPAA for years. HIPAA was enacted by the federal government for several purposes, including better portability or health insurance as a worker moved from one job to another, deterrence of fraud, abuse, and within the healthcare delivery system, and simplification of the administrative functions associated with the delivery of healthcare, such as reimbursement claims to Medicare and Medicaid. Simplification of administration functions entailed the adoption of electronic transactions that included sensitive healthcare information. To protect the privacy and security of health information, two sets of federal regulations were implemented. The privacy rule became effective in 2003, and the security rule became effective in 2005. Many practitioners that refer to HIPAA are not referring to the comprehensive federal statute enacted in 1996, but rather to the privacy and the security rule, that is, the federal regulations that were adopted years after HIPAA became law. Under the privacy rule, patients have a right to expect privacy protections that limit the use and disclosure of their health information. Under the security rule, providers are obligated to safeguard their patients' health information from improper use or disclosure, maintain the integrity of the information, and ensure its availability. Both rules apply to protected health information defined as any physical or mental health information created, received, or stored by a covered entity that can be used to identify an individual patient regardless of the form of the health information. For example, it can be electronic, handwritten, or verbal. Covered entities include hospitals and other healthcare providers that transmit any health information electronically, as well as health insurance companies and healthcare clearinghouses. Clinicians have become very knowledgeable about the requirements of the privacy and security rules. They're familiar with their obligations to protect patients' information and the rights afforded to their patients under these regulations. Patients are entitled to a notice of privacy practices from their healthcare providers. Inpatients are entitled to opt out of the facility's directory, thereby protecting disclosure of information if they are even a patient in the facility. Under certain circumstances, patients must authorize disclosure of their protected health information before it can be released by the provider. Patients can request and obtain access to their own healthcare records and may request that corrections and additions be made to their records. Providers must consider a patient's request to amend a healthcare record, but they are not required to make such an amendment if the request is unwarranted. Unauthorized access or use of or any loss of healthcare information must be disclosed to any patient affected by the breach. Patients may request an accounting of anyone who accessed their healthcare information, and the provider is required to provide that information in a timely manner. Finally, patients have a right to complain if they perceive that the privacy or security of their healthcare information has been compromised in some way. Compliance with privacy and security rules is mandatory for all covered entities, and HITECH ACT extends compliance with these requirements directly to other entities that are business associates of a covered entity. Requirements include designation of privacy and information security officials to protect health information and appropriate handling of any complaints. Sanctions must be imposed if a violation of HIPAA occurs. The privacy and security rules also mandate that certain physical and technical safeguards must be implemented for protected health information, and they require entities to conduct periodic training for all staff to ensure compliance with these safeguards. Most entities adhere to industry standards and provide their personnel with yearly training. In addition, entities are to conduct regular audits to ensure compliance, and any breaches in the privacy or security of protected health information must be corrected immediately. It is important to avoid a security incident defined as the attempted or successful unauthorized access, use, disclosure, modification, or destruction of information or interference with a system operations in an information system. Such triggers or incidents trigger certain notification requirements. Such complaints can be made directly to the provider or to the Office of Civil Rights. The OCR, which is part of Health and Human Services, is responsible for enforcing HIPAA. It provides significant information and guidance to clinicians who must comply with the privacy and security rules. It has been tracking complaints and investigating violations since 2003. As an example, one such violation involved a nurse practitioner who had privileges within a healthcare system. She accessed her ex-husband's medical records without his authorization by using the system-wide electronic health record. A complaint was filed and the OCR investigated the matter. The OCR resolved the complaint with the healthcare system. As part of this resolution, the healthcare system curtailed the nurse practitioner's access to its electronic health records, and it required her to undergo remedial training. In addition, it reported the nurse practitioner to her professional board. The HITECH Act has had a significant impact on HIPAA's privacy and security rules in the following ways. Health and Human Services is to provide annual guidance about how to secure health information. Notification requirements in the event of a breach in the security of health information have been advanced. HIPAA requirements now apply directly to any business associates of a covered entity. The rules that pertain to providing an accounting to patients who want to know who access their health information have been changed, and enforcement of HIPAA has been strengthened. These measures are being implemented to provide further assurance that health information will be protected as the country transitions to a nationwide health information infrastructure. Many businesses are moving to enact a bring your own device policy for employees. This policy, which helps to streamline the lives of employees by maintaining personal and business information on one device, can also result in cost savings for the organization. BYOD, or bring your own device, is an issue, however, when dealing with protected health information. Healthcare organizations typically do not encourage use of personal devices for professional matters, and in many instances, they actually have policies in place forbidding employees from using personal devices in the workplace. According to HIT Consultant 2013, approximately 50% of healthcare organizations report that personal mobile devices can be used to access the internet within their facilities, but these devices are not given access to the organization's network. Typically, only devices that are used by the organization, secured and routinely audited, are able to access the network. Nurses must exercise caution when bringing their personal devices into the healthcare organization to ensure that they are not violating any specifics of the BYOD policy. Associated with this right to privacy, the nurse has a duty to maintain confidentiality of all patient information. The patient's well-being could be jeopardized and the fundamental trust between patient and nurse destroyed by unnecessary access to data or by the inappropriate disclosure of identifiable patient information. The rights, well-being, and safety of the individual patient should be the primary factors in arriving at any professional judgment concerning the disposition of confidential information received from or about the patient, whether oral, written, or electronic. The standard of nursing practice and the nurse's responsibility to provide quality care require that relevant data be shared with only those members of the healthcare team who have a need to know that information. Only information pertinent to the patient's treatment and welfare should be disclosed, and only those directly involved with the patient's care. When using electronic communication, special efforts should be made to maintain electronic data security. The similarities between these ethical obligations and the legal requirements of HIPAA and other federal and state privacy and confidentiality laws are readily apparent to nurses. By complying with their ethical code, nurses were complying with privacy and security rules before they were required to do so. Since the adoption of the HIPAA and privacy security rules, and now with the passage of the HITECH Act, it is more important than ever for nurses to understand their obligations in this area and avoid the pitfalls of violations. The popularity of social and mobile networking applications is one indication of how new web-based technologies are changing communication preferences. The web is no longer a destination place, but instead has become a vehicle of communication where individuals use application software or apps, which are installed or downloaded to connect with others. Individuals act as their own portal and can connect from anywhere with their various communities. This makes it difficult to separate out various communities and social networks, where once it was relatively easy to separate work relationships from friends and families, networked communities tend to overlap, blurring the boundaries between them. The phenomenon of overlapping networks means that the unintended audience is almost always greater than the intended one. A status update that may be construed as a harmless and funny to one's friends could be taken an entirely different way by family or colleagues. This is not to say network communities are harmful or bad. Indeed, the benefits of such communities far exceed their negatives. However, the immediacy and the permanence of the updates shared mean that the user must think about the impact beyond the intended audience in ways never before required. Nurses and other healthcare workers who use social media must be aware that the overlapping of networks may unintentionally create privacy and confidentiality breaches. Even when patients are not identified by name, general sharing of information or venting about a difficult day may constitute a privacy breach. The National Council of State Boards of Nursing in 2011 collaborated with the ANA to develop specific guidelines for use of social media by nurses. The development and implementation of a nationwide electronic health record system holds great promise for nursing practice and nursing informatics. The profession of nursing will benefit from the many enhancements such as infrastructure has to offer, including the ability to improve the delivery of nursing care and the quality of that care, the ability to make more efficient and timely nursing care decisions for patients, the ability to avoid errors that may harm patients, and the ability to promote health and wellness for patients whom nurses serve. On a broader scale, nurse researchers will have the ability to more readily access data that can be used to continue to foster evidence-based practice. The possibilities seem endless. For those who devote their professional careers to nursing informatics or plan to do so, the opportunities abound. Much work remains to be done as this country transitions to a nationwide health information infrastructure. However, and there are monetary incentives available from the government for adopting systems that comply with meaningful use requirement. All nurses need to be engaged in this process, whether they treat patients or managers within healthcare organizations, teach, develop computer programs, or help create institutional or governmental policies. Nurses, as the end users of developing technologies, cannot afford to be left behind in these exciting times. Their voices must be heard, whether it is within the facility where they work as changes to the EHR system are contemplated, or whether it is in the public policy arena. How often are nurses the last to know that a new EHR system has been adopted by the hospital? How many times have nurses been trained to use a system that would have benefited from their input before it was implemented or even purchased? Nurses often are not invited to the table when entities make decisions about informatics, so they should not be afraid to ask to be included, whether it is to be heard within the workplace or within the governmental agencies that are overseeing the changes that are taking place. Even nurses who do not get involved in this process need to stay current with the rapid changes that are taking place. Information about federal initiatives is available from the ONC and the OCR. Both offices are housed within Health and Human Services and are excellent sources for additional information about HITECH ACT and HIPAA. Regulations to implement the HITECH Act and enhance the HIPAA protections required by it are being proposed and adopted at a rapid pace.